Mr. Smith.
Hi.
I am Frank Kanabe, a PA student. Can you tell me why you're in here today?
I just have a hard time breathing.
Can you explain, like, hard time breathing?
It was like yesterday morning I woke up and I had a coughing episode, and after that it was just a really sharp pain and on my left side, and then I just had a hard time breathing, and it just progressively got worse and worse. I thought I just slipped on it funny or something, but it just got worse and worse.
All right, so you were coughing, you said, when you woke up?
Yeah.
Coughing. Okay. Anything make it worse or make it better?
If I laid down, it's a lot worse. I do better getting breaths in if I sit up or stand up.
All right, can you kind of show me where the pain is?
It's right there.
All right, does the pain go anywhere else on your body?
When I breathe in, it goes to my other side.
To the other side? How about any pain in the back, in your back at all?
Some pain in my back.
All right, on a scale of 1 to 10, or 0 to 10, 0 being no pain, 10 being the worst pain you've ever felt, what would you rate it?
It's probably about a 7 or 8 right now. When it started out, it wasn't too bad as far as pain, but it was like a 5 or 6, but now it's like a 7 or 8.
So it's
really
progressively getting worse?
Yeah.
Okay. And the type of pain, it's sharp, is it dull?
It's sharp.
And it's constant? Or does it get worse when you take a breath in?
It gets worse when I take a deep breath in.
Okay. And this is within the last 24 hours? You said this morning when you woke up?
Yeah, it was about yesterday, and so it was about 24 hours, a little after 24 hours today.
All right, Mr. Smith, do you have any allergies to medications?
No allergies.
Are you taking any medications?
Just like a daily vitamin and some Tylenol every once in a while for a headache. Other than that, I don't have any.
Okay, how about some past medical history, any operations, procedures?
I broke my leg when I was like 16, but other than that, I haven't had any major problems.
Okay, and you ate this morning?
Yes.
And is the events, you just woke up and were coughing, that's when you felt the pain? All right, and there was no trauma, you weren't in a car accident, you didn't get punched, and nothing, all right. Any history of asthma?
No history of asthma.
How about smoking? Do you smoke?
I smoke about a pack a day.
Okay, pack a day. All right. What I'm going to have you do now, or your family history. Is there any lung issues in your family?
Not that I know
parents?
of. No.
Okay. All right. What I'll have you do is remove your shirt. I'm going to do a visual assessment on you. I'm going to listen to your lungs, see what's going on, and then also I'm going to order an X-ray, and that way we can see inside there, see exactly what's going on. I understand that you're in considerable pain, so I'm going to leave here and go consult with my PA. If the pain does get worse, let the nurse know.
Okay.
All right? Thank you, Mr. Smith. Thomas, in bed 3, we have a 23-year-old male complaining of respiratory pain. It's rapid onset, came on this morning after a coughing jag. He rates of pain at a 7 to 8. Has no history of asthma, but he does smoke. So the physical findings are, upon visualization, I can see that he's actually like guarding on his left side. It's just kind of slumped over there with inspiration. The pain radiates upon inspiration contralaterally. He has mild JVD. His breathing rate is increased to 24, and he's tachycardic at 120.
Okay, so how does he look in general?
It looks like he's having a difficult time breathing. He needs some intervention.
Okay, well, it sounds like a classic case. What do you think it is?
I think it's based on his age. He's a tall, slender guy, and he smokes. So I tend to think it's a spontaneous pneumo.
Yeah, that's a good guess. Good difference. What test did you order?
I did order a chest X-ray, and I have it with me.
Okay, let's take a look at it. Okay. Yeah, that's obviously a pneumothorax. You can see the hyperlucency here on the left side, the mediastinal shift, the collapsed lung. You can see that right there.
Yes.
Let's get some oxygen on him right away. Place a chest tube, reinflate that lung. Let's go to send him to CT and a surgical consult.
Okay.
All right, good job.
Thank you, sir. All right, Mr. Smith, it does appear after looking at your X-ray that you do have a collapsed lung, okay? So what we're going to do is we're going to get you on some O2. to help you breathe. And then I'm going to lay you down and insert a tube into the fifth intercostal space on your mid-axillary side, which is going to be right down here. And what that's going to do is going to pull the air out and any fluids or blood that might actually be in there to help reinflate that lung. Once we can get that lung reinflated, we're going to send you out for CT, just to make sure there's no other issues that we need to address. Mr. Smith, this is my colleague, Mr. Meyer here. He's going to go over the
Pleasure to meet you.
things with you.
My colleague, Mr. Kanabe, brought me in on your care because the CT we took of your chest showed that you had an apical bleb, which basically is just a weakness in your lung tissue. There's nothing really that causes that other than genetics, and your smoking does contribute to that. It causes a weak spot in the top of your lung, which when you coughed, it probably popped it open, and that pressure differential caused your lung to collapse down, which is why you're having so much difficulty breathing before they put in the chest tube. There's a couple of ways that we can treat this. The first way is just to let your lung reseal up and remove the chest tube after a day or two. The bleb will probably seal up and you may be fine for a while. This does have a high incidence of recurrence. It could also occur on the other side. One of the treatment options that we like to offer patients is a thoracoscopic bleb resection with pleurodesis. We go into your chest with a camera and we staple off the bad lung tissue and seal it shut, and then we scratch the inside of your chest wall to create some inflammation. That causes your lung to adhere to your rib cage and stay inflated. If we do that, then your chance of recurrence is less than 15%.
Okay, let's go ahead and do surgery. I don't want to go through that again.
Okay, all right, that sounds good. We'll get you scheduled with the OR, and we'll just be back to talk to you.
Okay.